how to read dental x-rays. This learning will be of great help to dental students for their exams and to dental surgeons for better communication with colleagues. First, define whether it is an intraoral x-ray or extraoral x-ray. Second, inform which x-ray it is, like it is orthopentomogram, intraoral periapical x-ray, occlusal view x-ray, or it is cone beam computed tomograph. Third, answer which normal anatomical region it is showing. As for example, it is intraoral periapical x-ray of maxillary anterior teeth region, or it is intraoral periapical x-ray of mandibular posterior teeth region. Now, if you have real x-ray film, find out the side of it by checking the dot projection of the film and answer like it is intraoral periapical x-ray showing right posterior teeth region of mandible. You can't define side if it is a print or it is a soft copy. For occlusal view x-ray, answer like it is occlusal view x-ray of mandible or it is occlusal view x-ray of maxilla. In case of orthopentomogram, anatomy is always maxilla, mandible along with lower half of maxillary sinus and nasal cavity. Other extraoral x-rays of skull like paranasal sinus view, lateral view or posterior anterior view, the anatomy is always skull. For cone beam computed tomographs reading, answer should include which quadrant of which jaw, like it is cone beam computed tomograph of anterior region of mandible. Now fourth, find out the pathology or any abnormal finding on particular x-ray and describe radiographic features of it in terms of radiolucency or radioopacity, its size, its shape, its location or involvement of the anatomy, whether it is single or multiple, and whether it is ill-defined or diffuse. Now the fifth is conclusion of everything. That means give your radiological diagnosis. I'll give you some example readings. First, we will see the intraoral periapical x-ray. Your answer should be somewhat like this. This is intraoral x-ray, that is intraoral periapical x-ray showing mandibular posterior teeth, second premolar and all three molars with their periapical region, where second molar has crown loss due to caries and roots have incomplete root canal filling with around 3 mm radiolucency with ill-defined margins surrounding the apices. As per the radiographic findings, it could be a chronic periapical abscess or infected radicular cyst due to caries. Now the second example, this is intraoral x-ray, that is again intraoral periapical x-ray of maxilla anterior region showing lateral incisor, canine and premolars with periapical region. All teeth are carious and canine and second premolars have crown loss. Canine and premolars have around 2 mm periapical radiolucences with ill-defined margins, which favor diagnosis of chronic periapical abscesses or infected radicular cysts due to caries. Third example, it is intraoral x-ray, occlusal view of mandible showing a radiolucent irregular line between lateral incisor and canine extending to second molar lingually and up to central incisor buccally, separating alveolar bone from this teeth. It also shows arch bar and ivy lobes fixed on teeth. Radiographically, it is a displaced compound fracture of mandible with some treatment going on. The fourth example, this is extraoral X-ray orthopentomogram showing maxilla, mandible with teeth and midface region. The patient has multiple teeth treated with conservative dental treatments. 2-8, 3-8 and 4-8 are impacted, and there is a single roughly oval non-septate unilocular around 3.5 centimeter diameter radiolucency around impacted 4-8 crown, and which is extending up to the first molar and base of the mandible, and it has well defined radioopaque margin posteriorly and ill defined margin anteriorly. It can be a dentigerous cyst or it can be a radicular cyst due to caries 4746. Fifth example, this is extraoral X-ray, that is orthopentomogram showing maxilla, mandible with teeth and midface region with two irregular radiolucent lines. First is at 4-8 region involving alveolar bone to the base of the mandible, and second is at right side junction of region of low condyle with ramus, extending from posterior margin of ramus to mandibular notch. Radiographically, it is compound minimally displaced fracture at 4-8 or at the junction of right side body and angle with simple minimally displaced fracture of mandible at junction of low condyle with ramus. Now the sixth, this is extraoral X-ray, that is cone beam computed tomograph of anterior region of mandible showing impacted 3-3 with its crown labially at midroot level of 3-1 and 3-2. Extraoral X-rays like posterior anterior view, paranasal sinus view, lateral view X-rays of skull are of not suggested much in this era of computed tomographs and magnetic resonance imaging for oral surgery diagnosis and the procedures. Last, I would like to advise students, never use short forms when you are asked to read any X-ray in exams. Don't answer this is OPG or this is IOPA, but say this is orthopentomogram or this is intraoral periapical X-ray. I hope this learning will help all of us for better dental communication. Thank you.